What happens to wavelength when frequency increases? A. It increases. B. It decreases. C. It remains constant. D. It doubles. Answer B. Wavelength and frequency are inversely related. When frequency increases, wavelength shortens because sound travels at a constant speed in the same medium. What determines the speed of sound in tissue? A. Frequency of sound. B. Wavelength of sound. C. Density and stiffness of the medium. D. Intensity of the beam. Answer C. The speed of sound depends only on the medium's density and stiffness, not on the transducer frequency. If the PRF increases, what happens to the imaging depth? A. It increases. B. It decreases. C. It stays the same. D. It doubles. Answer B. A higher pulse repetition frequency, PRF, allows for faster listening times, reducing maximum imaging depth. The unit of intensity in ultrasound is A. W/cm superscript 2. B. J/cm superscript 3. C. Hertz/s. D. dB/m. Answer A. Intensity measures power per unit area, expressed as watts per square centimeter, W/cm superscript 2. Which transducer type provides the best temporal resolution? A. Phased array. B. Linear sequential array. C. Mechanical sector. D. Curved array. Answer A. Phased array systems have rapid electronic steering and focus control, improving temporal resolution. Increasing frequency will A. Increase penetration and resolution. B. Decrease resolution. C. Increase resolution but decrease penetration. D. Decrease both resolution and penetration. Answer C. Higher frequencies enhance detail, axial resolution, but reduce tissue penetration due to greater attenuation. Which control adjusts the number of echoes displayed on the image? A. TGC. B. Gain. C. Dynamic range. D. PRF. Answer B. Gain amplifies returning echoes, controlling overall image brightness. The term attenuation refers to A. Amplification of echoes. B. Loss of sound energy as it travels. C. Increase in reflection. D. Refraction of sound waves. Answer B. Attenuation is the gradual loss of sound intensity due to absorption, scattering, and reflection. Which artifact occurs when sound bounces between two strong reflectors? A. Reverberation. B. Shadowing. C. Enhancement. D. Mirror image. Answer A. Reverberation artifacts appear as multiple, equally spaced echoes from repeated sound reflections. What improves lateral resolution? A. Narrower beam width. B. Higher PRF. C. Lower frequency. D. Increased imaging depth. Answer A. Lateral resolution depends on beam width. A narrower beam provides better resolution side to side. What happens to pulse duration when the number of cycles per pulse decreases? A. It increases. B. It decreases. C. It doubles. D. It remains unchanged. Answer B. Fewer cycles per pulse shorten pulse duration, improving axial resolution. What does the Doppler effect measure in ultrasound? A. Tissue density. B. Beam width. C. Tissue stiffness. D. Blood velocity. Answer D. The Doppler effect evaluates frequency shifts from moving red blood cells, indicating velocity and direction of flow. If the Doppler angle increases from 0 degrees to 60 degrees, the measured velocity will A. Increase, B. Decrease, C. Remain unchanged, D. Reverse direction. Answer B. As the Doppler angle increases, the cosine value decreases, resulting in lower measured velocity. The main advantage of continuous wave Doppler is A. Ability to measure very high velocities, B. Imaging depth control, C. Range resolution, D. Color display. Answer A. CW Doppler accurately detects high velocities without aliasing but lacks depth specificity. The main cause of aliasing in spectral Doppler is A. Low PRF, B. High wall filter, C. Poor focus, D. Large sample volume. Answer A. Low PRF limits the sampling rate, causing higher velocities to be misrepresented as reversed or wrapped signals. Increasing the dynamic range results in A. More contrast, B. Less contrast, more gray shades, C. Fewer gray shades, D. Brighter image only. Answer B. A wider dynamic range allows for more gray shades, reducing contrast between tissues. What does spatial compounding do? A. Reduces speckle noise, B. Increases attenuation, C. Increases refraction, D. Enhances aliasing. Answer A. Spatial compounding combines images from multiple angles to reduce noise and improve image clarity. The ability to distinguish two structures that lie parallel to the beam is called A. Lateral resolution, B. Axial resolution, C. Temporal resolution, D. Elevational resolution. Answer B. Axial resolution measures the system's ability to separate structures along the beam's path. What is the function of the matching layer in a transducer? A. Increase impedance mismatch, B. Absorb scattered waves, C. Reflect echoes, D. Improve sound transmission into tissue. Answer D. The matching layer minimizes impedance differences between the crystal and skin, enhancing energy transmission. Which material generates ultrasound in a transducer? A. Carbon fiber, B. Piezoelectric crystal, C. Metal foil, D. Tungsten coil. Answer B. Piezoelectric crystals convert electrical energy to mechanical sound waves and vice versa. Increasing line density in beam mode imaging improves A. Frame rate, B. Axial resolution, C. Temporal resolution, D. Lateral resolution. Answer D. More scan lines create finer image detail but reduce frame rate. What determines frame rate? A. Beam width only, B. Depth and line density, C. Frequency only, D. Attenuation rate. Answer B. Deeper imaging and higher line density both slow frame rate, affecting temporal resolution. The main reason for using a backing layer in transducers is to A. Increase ringing, B. Strengthen beam width, C. Amplify echoes, D. Dampen vibrations. Answer D. The backing layer absorbs extra vibrations, producing short pulses that improve resolution. When sound travels from a slower to a faster medium, refraction bends A. Toward the normal, B. Away from the normal. C. Straight ahead. D. Reflects back. Answer B. According to Snell's law, sound bends away from the normal line when entering a faster medium. Which artifact appears as a duplication of a structure on the opposite side of a strong reflector? A. Comet tail. B. Mirror image. C. Ring down. D. Speed error. Answer B. Mirror image artifacts occur when sound reflects off strong interfaces like the diaphragm. The main determinant of axial resolution is A. Pulse length. B. Beam width. C. Frame rate. D. PRF. Answer A. Axial resolution improves with shorter spatial pulse lengths, which depend on frequency and damping. What happens to attenuation coefficient as frequency doubles? A. It decreases. B. It doubles. C. It remains constant. D. It is halved. Answer B. Attenuation coefficient increases proportionally with frequency in soft tissue. What causes acoustic shadowing? A. High reflection and absorption behind dense objects. B. Excessive refraction. C. Gain overcompensation. D. Low PRF settings. Answer A. Dense structures like bone or stones block sound, causing a shadow posteriorly. What describes the duty factor? A. Ratio of pulse duration to PRP. B. Ratio of gain to depth. C. Ratio of PRF to frequency. D. Ratio of amplitude to impedance. Answer A. Duty factor expresses the percentage of time the system transmits sound versus listens. Increasing depth will have what effect on PRF? A. Increases PRF. B. Decreases PRF. C. No effect. D. Causes aliasing. Answer B. As imaging depth increases, PRF decreases to allow sound to return from deeper structures. The relationship between period and frequency is A. Directly proportional. B. Inversely proportional. C. Equal. D. Random. Answer B. Frequency and period are inversely related, as one increases, the other decreases. Increasing transducer diameter improves A. Lateral resolution at greater depths. B. Axial resolution. C. Frame rate. D. Temporal resolution. Answer A. A larger aperture produces a narrower beam, improving lateral resolution at depth. The primary function of the receiver in the ultrasound system is to A. Generate sound pulses. B. Process returning echoes. C. Steer the beam. D. Store patient data. Answer B. The receiver amplifies, detects, and processes returning echoes for image formation. Which control compensates for attenuation at deeper depths? A. TGC. B. PRF. C. Power output. D. Dynamic range. Answer A. Time gain compensation, TGC, equalizes brightness by amplifying deeper echoes more. Which unit measures frequency? A. Watt. B. Hertz. C. Joule. D. Newton. Answer B. Frequency is measured in hertz, cycles per second. The ability to correctly position moving structures over time is A. Lateral resolution. B. Depth accuracy. C. Spatial resolution. D. Temporal resolution. Answer D. Temporal resolution depends on frame rate, representing motion accuracy. What happens if the beam is steered too obliquely in Doppler imaging? A. Velocity increases. B. Signal decreases. C. Aliasing occurs. D. Flow reverses. Answer B. Oblique angles reduce the Doppler frequency shift and weaken the detected signal. What is the purpose of a wall filter in Doppler imaging? A. Reduce aliasing. B. Eliminate low-frequency noise. C. Improve axial resolution. D. Amplify echoes. Answer B. Wall filters remove low-frequency signals from vessel wall motion to improve clarity. Which of the following improves signal-to-noise ratio, SNR? A. Lower output power. B. Increased beam attenuation. C. Higher output power. D. Reduced gain. Answer C. Increasing output power boosts echo strength relative to background noise. When two waves combine to form a stronger wave, this is A. Destructive interference. B. Constructive interference. C. Diffraction. D. Reflection. Answer B. Constructive interference occurs when sound waves combine in phase, increasing amplitude. The frame rate of real-time ultrasound primarily affects A. Color resolution. B. Axial detail. C. Image depth. D. Motion accuracy. Answer D. Frame rate determines how smoothly motion appears in real-time imaging. Which transducer has a small footprint ideal for cardiac imaging? A. Curved array. B. Phased array. C. Linear array. D. Annular array. Answer B. Phased array transducers are compact and electronically steered, ideal for cardiac use. What happens when you increase the number of focal zones? A. Frame rate decreases. B. Image becomes darker. C. Temporal resolution improves. D. Beam width widens. Answer A. Multiple focal zones slow frame rate because each frame requires multiple pulses per line. Which artifact appears as a region of increased brightness behind a weakly attenuating structure? A. Reverberation. B. Shadowing. C. Enhancement. D. Mirror. Answer C. Enhancement occurs when sound travels through a low attenuation structure like a cyst, increasing brightness behind it. What causes speckle artifact? A. Interference of scattered echoes. B. Excessive gain. C. Low PRF. D. Attenuation. Answer A. Speckle results from constructive and destructive interference of scattered echoes. In color Doppler, hue represents A. Flow direction. B. Flow velocity. C. Signal strength. D. Sample volume size. Answer A. Hue or color shift indicates direction of blood flow relative to the transducer. The dead zone on an ultrasound image is A. The area of maximum gain. B. The region closest to the transducer where echoes are not displayed. C. The deepest part of the image. D. The strongest echo area. Answer B. The dead zone is a shallow region where transducer ringing prevents proper echo detection. What is the main advantage of harmonic imaging? A. Increased frame rate. B. Faster data storage. C. Lower frequency penetration. D. Improved contrast resolution and reduced artifacts. Answer: D. Harmonic imaging enhances contrast and reduces near-field artifacts for clearer images. If the sound wave frequency is 5 MHz, what is its period? A. 0.5 microseconds. B. 0.2 microseconds. C. 1 microsecond. D. 5.0 microseconds. Answer: B. Period equals 1/frequency 1/5 MHz equals 0.2 microseconds. The acoustic impedance mismatch between tissues causes A. Reflection. B. Refraction. C. Absorption. D. Diffraction. Answer: A. Differences in acoustic impedance between tissues lead to partial reflection of sound waves.